Picture this. You're a fierce Viking warrior, fresh from a brutal raid, but there's something gnawing at you that's far worse than any enemy blade. Deep in your jaw, a rotten tooth is pulsing with agony that makes you want to scream. There's no dentist to call, no painkillers to pop, and definitely no insurance to cover the procedure. You've got two choices. Endure the excruciating pain until it potentially kills you, or grab whatever tools you can find and yank that tooth out yourself. Welcome to dental care in the Viking Age, where toughness wasn't just an attitude, it was a survival skill. Now, before we dive into the brutal reality of Viking tooth extraction, here's something that's going to surprise you. Vikings actually had remarkably good teeth for their time. I'm talking a better oral health than people living centuries after them. This wasn't luck or some ancient dental magic. It was all about their lifestyle and diet. While medieval Europeans were rotting their teeth with sugar and refined foods, Vikings were living on a diet that modern dentists would actually approve of. Their meals consisted of fish, meat, vegetables, and grains, with almost zero added sugar. No candy, no sweet treats, no processed junk that we demolish our teeth with today. This low-sugar diet meant significantly less tooth decay compared to what would come later in history. Archaeological evidence shows that while Vikings did have dental problems, they were nowhere near as severe as what plagued people in later medieval periods. But here's the catch that made their lives miserable. The grain they ate was ground using stone mills, and tiny fragments of stone would end up mixed into their flour. Every piece of bread, every meal made with grain, was like chewing on sandpaper. This constant grinding action wore their teeth down to nubs over time. Imagine your molars getting shorter and shorter every single day until the nerves were exposed. The pain must have been absolutely unbearable. Vikings also lived incredibly violent lives. Raids, battles, accidents and fights were just part of everyday existence. A well-placed punch, a fall, or a weapon to the face could crack or shatter teeth in an instant. When you combine worn-down teeth from stone fragments with the constant risk of dental trauma, you get a recipe for serious problems. When a tooth became infected or abscessed, Vikings faced a life-or-death situation. These weren't just painful inconveniences. Dental infections could and did kill people regularly. The infection could spread through the bloodstream, causing sepsis and death within days. There was no calling in sick, no taking time off to recover. If that tooth was going to kill you, it had to come out, and it had to come out fast. The Vikings understood something that many people today don't fully grasp. Sometimes the most extreme action is the only action that will save your life. They couldn't afford to be squeamish about medical procedures, especially when their survival depended on taking matters into their own hands. Archaeological discoveries have revealed fascinating evidence of Viking dental practices that go way beyond simple tooth pulling. Researchers have found Viking skulls with carefully filed holes drilled directly into infected molars, going right down into the tooth's pulp. This wasn't random damage or decay. This was a deliberate medical procedure designed to relieve pressure and drain infection from inside the tooth. It's essentially the same principle behind modern root canal procedures, just executed with primitive tools and no anesthesia. The sophistication doesn't stop there. Many Viking remains show clear evidence of regular toothpick use, indicating they were actively trying to keep their teeth clean. Some Vikings even filed decorative grooves into their front teeth, showing they cared about dental appearance as much as dental health. These weren't the barbaric savages that popular culture often portrays. They were people who understood the importance of oral hygiene and developed surprisingly advanced techniques for dealing with dental problems. But when all the preventive care and clever procedures failed, when the pain became unbearable and the infection life-threatening, there was only one option left. The tooth had to be extracted, and in most cases they had to do it themselves. The actual process of extracting a rotten tooth was a test of endurance that could last for days. Vikings didn't just grab a tooth and yank it out in one go. That's a Hollywood myth that would result in broken jaws and shattered teeth. The real technique required patience, strategy, and an iron will to endure prolonged agony. The extraction process began with loosening the problematic tooth by rocking it back and forth, day after day, using their fingers wrapped in cloth for better grip, or sometimes crude metal implements like tongs or primitive pliers. They would apply steady pressure in different directions. This wasn't a quick process. It could take 3, 4, even 5 days of constant manipulation to get the tooth loose enough for extraction. Imagine the dedication required to voluntarily inflict that kind of pain on yourself for days on end. The key was persistence without being reckless. Too much force too quickly would snap the tooth at the root, leaving infected pieces buried deep in the jawbone. This created an even worse situation than the original problem. Vikings learned through brutal trial and error that slow, steady loosening was the only way to ensure a clean extraction. Once the tooth was sufficiently loose, the final extraction required one decisive moment of courage. They would wrap their fingers in cloth or leather for grip, get a firm hold on the tooth, and pull with one quick, hard motion. There was no second chance. If you hesitated or pulled at the wrong angle, the tooth could break apart. But what about the excruciating pain? Vikings weren't superhuman, despite their legendary toughness. They developed several methods for managing the agony of self-extraction. The most common approach was getting thoroughly drunk on mead or ale before attempting the procedure. Alcohol served as both liquid courage and primitive anesthesia, numbing the senses enough to make the process bearable. They also discovered that chewing on willow bark provided significant pain relief. This wasn't just folklore or wishful thinking. Willow bark contains salicin, the same compound found in modern aspirin. Vikings unknowingly created their own natural painkiller by harvesting and preparing willow bark for dental procedures. They would chew it beforehand and pack it around the affected tooth to reduce inflammation and dull the pain. Another common technique involved biting down on a thick leather strap during the extraction itself. This served multiple purposes. It prevented them from accidentally biting their tongue or cheek during moments of intense pain, gave them something to focus their energy on, and helped muffle any screams that might attract unwanted attention from enemies or predators. The risks involved in self-extraction were absolutely terrifying by modern standards. Massive bleeding was almost guaranteed. Without proper tools or sterile conditions, Vikings would often lose dangerous amounts of blood during the procedure. Some bled to death from what should have been a routine extraction. There were no blood banks, no emergency medical services, and no way to stop severe hemorrhaging once it started. Infection was an even deadlier threat. The mouth is filled with bacteria, and creating an open wound through tooth extraction provided a direct pathway for that bacteria to enter the bloodstream. Post-extraction infections could spread rapidly throughout the body, causing sepsis and death within days. Vikings had no antibiotics, no antiseptics, and no understanding of germ theory. They were essentially performing surgery in the most bacteria-rich environment possible with no protection whatsoever. Even successful extractions often left behind problems that would plague Vikings for the rest of their lives. Broken tooth roots frequently remained embedded in the jawbone, creating ongoing sources of infection and pain. Without X-rays or modern surgical techniques, there was no way to remove these fragments completely. Vikings would live with constant low-level infection and discomfort, never knowing when their dental problems might flare up again. The crude tools available made clean extractions incredibly difficult. Basic metal tongs or pliers would often crack adjacent teeth or fracture the jawbone itself. The force required to remove a deeply rooted tooth could cause devastating collateral damage to the entire mouth. Many Vikings ended up with multiple missing teeth after a single extraction attempt gone wrong. Despite these horrific risks, Vikings continued performing self-extractions because the alternative was certain death from spreading infection. They understood that temporary agony and potential complications were preferable to the guaranteed fatal outcome of leaving an abscessed tooth untreated. This wasn't bravery in the traditional sense. It was cold, calculated survival instinct, driving them to endure unimaginable pain. So there you have it. The brutal, fascinating truth about Viking dental care. These warriors who terrorized coastlines across Europe were performing primitive root canals, managing pain with natural remedies, and extracting their own teeth with nothing but raw determination and crude tools. They understood oral hygiene, used toothpicks religiously, and maintained better dental health than people would have for centuries after them. But here's the real kicker. Their secret weapon wasn't some ancient dental technique or mystical Norse knowledge. It was their diet. While later generations would destroy their teeth with sugar and processed foods, Vikings accidentally stumbled upon the perfect recipe for healthy teeth simply by eating what was available: fish, meat, vegetables, and grains with virtually no added sugar. Vikings didn't pull out their own teeth because they were tough. They did it because they had absolutely no choice. That kind of desperation breeds innovation, and their techniques laid the groundwork for modern dental procedures we take for granted today. Now, I want to hear from you. Could you do it? Could you spend 4 days loosening your own rotten tooth, drunk on mead and chewing willow bark, knowing one wrong move could kill you? Let me know in the comments if you think you'd have the Viking mindset to survive, or if you'd be the first one on the longship begging to go home. If this video made you see Vikings in a completely new light, hit that like button and subscribe for more brutal historical realities that put modern life in perspective.